We have to make sure that the politicians are held accountable.
Every administration had the ability to put a ban on asbestos.
When it comes to asbestos, it really is about power, money, and politics.
Our next speaker is Dick Lemen, and I suggest you listen carefully to Dick because no one really knows better the sort of whole picture about exposure circumstances and the number of people who develop mesothelioma.
Thanks, Steve. I wanted to talk a little bit today about a paper that I and Dr. Landrigan put out on how we got to where we are today in the fight to ban asbestos in the United States. I brought about 50 copies of the paper, so I'll put them on the desk and you can take a look at that after I talk. But I want to change a little bit of the direction of my talk and tell you a little bit about asbestos in the United States. It was first found in Vermont in 1823, and the industry took off by the end of the 1800s and were producing a lot of different asbestos products. And we started learning at that time about the disease potential of asbestos, and we saw workforces, some workforces in the United States had 80% of their workers developing asbestos-related lung diseases. And it was so common knowledge that the Encyclopedia Britannica in the early 40s and in 1950s was publishing in their description of asbestos that it caused not only non-cancerous lung disease, but also cancer. So the message was becoming known throughout the world that asbestos could cause disease and it could cause devastating disease. I got into the asbestos area in 1970 when I came out of graduate school and was assigned to the asbestos disease project. It was called a field study at that time. And when we first went into the asbestos plants in the United States, the federal government did not have the right of entry. So we had to get permission from the asbestos plants to go into them. I went into many asbestos plants without wearing respirators because the policy was if the workers weren't wearing respirators, we couldn't have the government coming in and embarrassing the company by wearing respirators. So after the Occupational Safety and Health Act was passed in 1970, we were able to go in. One of the big events of the Occupational Safety and Health Act gave the United States government the right to go to any facility or any plant in the United States and walk into that plant and evaluate the plant. So I've probably been in 30, 40 different asbestos work sites throughout the United States, manufacturing plants, and it was interesting that after the Occupational Safety and Health Act was passed in 1970, the very first standard that OSHA put out was for asbestos. That's how serious the problem was. I went into a plant in Tyler, Texas, where we found 50% of the workforce was suffering from asbestosis. The workers were sitting on piles of asbestos in that plant, eating their lunch. And the OSHA Act helped us change situations like that. There were many plants throughout the United States that did not have any types of controls. There were plants where you could walk in and you couldn't see one end of the room from the other end because the dust was so thick. We've come a long way from that point in the 1970s, but we haven't come far enough. We need to work diligently on banning asbestos in this country. Other countries have taken the lead in this, but we have not. And I hope that with the Alan Reinstein Ban Asbestos Now bill, we'll have a chance. I'm not so sure in this administration we're going to have much of a chance, but hopefully in the future we will be able to ban asbestos in the United States. I think what Dr. Selikoff said in 1970 may still be true today. He said to the Congress of the United States in the passage and working towards the passage of the Occupational Safety and Health Act, it is depressing to report in 1970 that the disease that we knew well 40 years ago is still with us, just as if nothing was ever known. I think add another 50 years to that, and it's still the same in the United States. We're increasingly seeing asbestos-related diseases. We're underestimating them tremendously, and I think you'll hear some more about that later in this conference. But we have a long way to go. We've come a long way, but we still need as much support from all of you to talk to your congresspeople and many others to support banning asbestos in the United States. And it's interesting, when I go around and I talk about asbestos, a lot of people say, oh, that was banned in the United States years ago. Well, I'm sorry to tell you that's not true. You can go out. I testified to Congress several years ago. We went out and bought some brake pads in Texas that were made of asbestos. And you can still buy products in the United States. As Linda talked about, the makeup for children. So we haven't solved this problem, and we're going to continue to see disease occurring in this country. And I know I have a short amount of time, so I'm going to stop there and let other speakers go forward. So thank you.